My advice for nurses who are thinking about going into research and integrating that to their practice is to open their eyes and observe and see what is missing in our practice. How can we make it better for patients? I'll give you an example, and in my study now, the reason why I'm focusing on this area is because I tried to look for evidence on how to manage chemotherapy-induced peripheral neuropathy. And when I looked at the evidence, it's actually lacking. There's not a lot of research in chemotherapy-induced peripheral neuropathy. And I tried to reflect on that and went back to when I'm in clinical practice, when I talk about nausea and vomiting, for example, or sepsis, I know what to do, the prevention and management of it, and I also know exactly where to find my evidence. But when I looked at peripheral neuropathy, I can't find, I don't know where to find my information. And then I started talking to colleagues about their experience and their knowledge about this, and they confirmed that actually there's not a lot out there that we can offer to patients, and that we can't find guidance to manage the symptoms. And I spoke to patients as well, involved them in co-producing this research and asking them, is this an important area of research? And they confirmed, the patients confirmed that yes, it is a problem, it is an issue, we have to do something about it. So if nurses start looking, opening their eyes, observing what's happening around in clinical practice, there are a lot of opportunities, a lot of areas that we can look at to better practice. So the theme of this year's conference is about crossing boundaries. And sometimes we put boundaries around ourselves, around our communities, within our local practice, and within nursing itself. So what we need to do as nurses is to step out of these boundaries and feel comfortable about sharing practice, sharing research, learning from each other and learning from the other members of the multidisciplinary team. And by doing that, we will be able to help patients, and we will be able to provide best practice to our patients. And as an academic, and as a clinician and a researcher, I believe that research plays a key role in this as well. We have to share research, we have to learn, and research requires time, and nurses should give time to do research, because by doing so, then we will become active drivers of improving practice. We will become advocates of making sure that the care that we provide is evidence-based, and then that is the best care that we can provide, and that is what we are for.